My presentation today is about acute and chronic compartment syndrome. Acute compartment syndrome is known as a life-threatening medical emergency and requires immediate surgical intervention, whereas chronic or exercise-induced compartment syndrome is not a medical emergency and can be treated and prevented without surgical intervention. Certain muscle groups in the human body, along with the blood vessels and nerve tissue that supply that muscle and surrounding area, are surrounded by rigid layers of tissue called fascia, and these fascia are what create muscle compartments within the body. These muscle compartments are typically found in the legs, arms, hands, feet, and buttocks. When there is any sort of trauma or muscle damage that causes increased fluid accumulation, blood accumulation, or increased pressure within a muscle fascia, that's what causes compartment syndrome. Because the muscle fascia do not expand, any swelling or increased pressure causes pressure on the blood vessels and nerve tissue that supply the muscle within the compartment. And because of this, there's lack of blood flow, oxygen, and nutrients to the muscle that are essential for keeping the muscle alive. Blood flow and oxygen is cut off to these muscles. This can lead to paralysis of the muscle and ischemia and necrosis of the muscle tissue. However, with chronic compartment syndrome, also known as exercise-induced compartment syndrome, this is usually due to an intense and frequent repetitive activities, and usually when the activity is stopped, the swelling within the muscle compartment subsides and pain is relieved immediately. Compartment syndrome is known to affect both males and females, but typically it is 10 times more likely to occur in males than it is females. Also, the typical age that you'll see compartment syndrome in males is around 30 years of age, and for females it's around 44 years of age, yet this can happen at any time within a person's life. As stated earlier, muscle compartments in the parts of the body that are affected are typically the legs, arms, hands, feet, and buttocks, but most cases of compartment syndrome occur in the forearm or lower leg between the knee and the ankle. Typically, there are a few main signs and symptoms of compartment syndrome. The first includes intense pain that far exceeds the typical pain that you would expect with the type of injury sustained. Second would be tingling, prickling, feeling, or numbness, and this is usually indicative of nerve tissue damage. Later down the line, the patient may feel numbness or paralysis, and that is usually indicative of permanent nerve tissue death. Also, the patient may experience pallor due to lack of blood flow and also a lack or decrease in the pulse. Also, the patient may have difficulty with moving the limb and also some bulging and swelling to the affected area just because of that increase in pressure. The gold standard for diagnosing compartment syndrome would be to insert a needle that is attached to a pressure gauge right into the compartment to measure the intercompartmental pressure. Also, you can use MRI and ultrasound to show swelling and edema, and the MRI will help show which muscle groups are involved in the injury. There are a few different treatment options for acute compartment syndrome. So if the compartment syndrome is being caused by bandaging or dressings that are too tight, the best option would first be to remove those dressings that are causing the increase in pressure. Next, in terms of emergency treatment, the doctor may perform a fasciotomy, where they'll cut open the muscle fascia to help relieve some of the tension. And then once the swelling and pressure goes down, they'll sew it up after a couple hours, and if they have to leave it open for an extended period of time, they may use a skin graft to help close up the wound. In terms of treatment for chronic compartment syndrome, the best option would be to stop the intense and repetitive activity, raise the limb above the heart to try to bring down the swelling, use ice, physical therapy, and also some anti-inflammatory drugs. The prognosis for compartment syndrome is typically dependent on the initial injury sustained. However, if there is immediate intervention for compartment syndrome, the muscle and nerve tissue can repair themselves and the prognosis is pretty excellent. However, if there is any delay in intervention, the decrease in oxygen and nutrients to the muscle can lead to ischemia, necrosis, and then tissue paralysis. So this would cause more issues then in the long run, and the prognosis wouldn't be as great. In terms of chronic compartment syndrome, by stopping the activity, using anti-inflammatory drugs, and icing the area, the swelling and pressure usually goes down pretty quickly, and pain subsides within a timely manner.